Hey, what's up, everyone? So, testosterone replacement therapy, TRT, can offer several benefits, particularly for men over 40 who experience low testosterone levels. Here are some key points highlighting the potential benefits of TRT for this demographic. Number one, it improves muscle mass and strength. Testosterone is critical for muscle growth and maintenance. TRT can help reverse the decline in muscle mass and strength often seen in older men, aiding in better physical performance and endurance. Number two, enhance mood and quality of life. Low testosterone levels are linked with mood swings, irritability, depression. TRT has been shown to improve mood and overall sense of well-being. Number three, increased bone density. Testosterone plays a significant role in bone mineral density. TRT can also help prevent osteoporosis and reduce the risk of bone fractures by increasing bone density. And number four, improved libido and sexual function. Testosterone is the key hormone influencing libido. TRT can boost sexual desire and improve erectile function in men who have low testosterone levels. Number five, better cognitive function. Some studies suggest that testosterone has a protective effect on the brain and that TRT might help improve cognitive function and memory. Number six, enhanced energy levels. Men undergoing TRT often report increased energy levels and a reduction in fatigue, which can improve overall daily functionality and vitality. Number seven, improve fat distribution. Testosterone influences body fat distribution, and TRT can help reduce fat mass, particularly in the abdominal area, thus potentially improving metabolic health. And number eight, cardiovascular health. While the evidence is mixed and continues to evolve, some research indicates that TRT might help improve cardiovascular health by increasing arterial dilation and improving lipid profiles. It's important for anyone considering TRT to consult a healthcare professional provider to thoroughly discuss the potential benefits and risk, as TRT is not suitable for everyone and can have side effects. Regular monitoring and adjustment based on individual response to therapy are essential to optimize outcomes and minimize risk.